Hi, this is Dr. Mike Barnes. You know, I was thinking of something. I've been thinking about it a lot lately. And the question that keeps running through my mind is addiction treatment, particularly at the residential level, maybe the partial hospital level, is it really rehabilitation or is it habilitation? And it seems that, a young adult will get sober maybe for the first time. They're in their late 20s, maybe early 20s. And when I talk to their families, they will say things like, he sounds like a 15-year-old. And, when is he going to kind of come around? When is he going to start acting like, you know, an adult? And I always have the same conversation with them at this point. And the idea that if your loved one started using drugs or alcohol at, say, age 12, 13, um, and starting to run around with a certain group of people that are like-minded, using like he's using or she's using. You have to think about what did they not get developmentally that they should have gotten. Um, and so when they get sober, they're not only dealing with trying to learn how to live a sober life. For many of them, they're trying to learn how to live a grown-up life. And so, this is one of the and let me just say, it's not only young people. I've had people in their late 30s say the same thing to me that, I get sober, but I've never really done anything. I haven't paid my own taxes. I haven't paid my own bills. I've been in and out of treatment for so much of my life. And so I would like to just take this opportunity to, not only think a little bit out loud and to introduce people to this idea, but really to talk to families about number one, how hard it is for your loved one to get sober. I mean, this is probably the hardest thing that they will ever do or ever have to do. Second is that the things that they didn't get in the process of growing up or in the process of being an adolescent, learning how to be autonomous, learning how to make decisions, learning how to defer gratification of their needs in order to get the next to get basic needs met or done. If they didn't learn those while they were using, they will have to learn those in early recovery. And so it's one of the reasons that we speak so frequently about sober living, or some kind of sober environment for those individuals, so that they can be with other people their age and maybe not feel so out of touch, but to also have a group of like-minded people who probably have those same things to learn, and so they can begin to support one another in that process. Rehabilitation sort of implies we're going to take you back to a skill set or to a coping set of skills that you had prior to this addiction, and we're going to rehabilitate you to reuse those skills. And I think that is the case for many people. But for a lot of our younger clients, I don't think that's the case. And I think that when we look at longer term, sort of ongoing community based structured care, is really kind of in the best interest of those clients. So just food for thought. If you have a loved one entering treatment, or you have a loved one that's in treatment or has just gotten out of treatment, the idea that you may need to look at your expectations a little bit and to see what is it that they need to learn in order to live the life that is possible for them. Okay, thanks. Take care.